My name's Angela. I am a mother of 2 daughters. I'm married. I love music. We play golf. So my family and I, we like good food. One thing I think we all can agree on that is a favorite is the barbecue, especially when the weather is good and we can spend time outdoors. I was diagnosed with non-small cell lung cancer. I was going to take on a new job overseas, and in preparation for that, I needed to undergo a health check, which included an X-ray. The doctor came back and said that they had seen something in my lung and they didn't know what it was. So they needed to run a few more tests to be sure. The PET scan came back and the doctor then decided that they needed to remove that nodule and test and see what it was. So following surgery, I asked him, I said, so what have you done? How much have you taken? And he said, well, we've taken the lobe. So I said to him, so I have cancer? And his response was, well, it's gone. I think from a mental point of view, there was both the shock and the relief, knowing that, yeah, I had it, it's gone, I can go back to life. I continued with my checkups, but at one point the doctor noticed that one of the markers was ticking upwards. At that point, it's not a question of whether the cancer is back, it's a question of where is it. The scans showed up with lots and lots of small tumors across both my lungs. He described it as it was as if somebody had poured sand into my lungs. They were all over the place, which meant that I was not a candidate for surgery again. So he sent me off immediately to the hospital to meet a thoracic surgeon. We agreed to do a biopsy, and they said that they were going to send all the tissue samples for genetic sequencing to find out whether I had a biomarker, which would then determine what kind of treatment I could get. I'd read quite a lot about the different biomarkers and what treatments were available. So I was really hoping that I had a mutation. They came back and said that I had the EGFR exon 19 deletion mutation, and that there was a drug, TAGRISSO, which I would be eligible to take.
TAGRISSO is a once-daily prescription pill used as a first treatment for adults with metastatic non-small cell lung cancer caused by certain abnormal EGFR genes.
So I went online and tried to read about other patients who were using the medication, just to get some perspective of what to expect. So far, it's actually been pretty good. I think the support I was getting from the professionals, the availability of information on how others have navigated this, all really worked to help me understand better what was coming next. Overall, my side effects have been pretty mild. The first was breaking out into hives. It was quite a surprise, your skin just breaking out quite suddenly. And I literally had my doctor on call because I would text him and call him to find out what do I do next, and he would keep giving me feedback on things to try out. The thing is, it's also a question of the mental perspective. I take mine every morning because I know if I don't do it in the morning, I'll never remember. I do have an alarm on my phone to remind me. For a newly diagnosed person, I would say to them first that this is their journey and they need to own it. And it means that they need to try and learn as much as they can about the illness. I would tell them to ask to get a biomarker test, because that way they will know whether they're eligible for targeted treatments, and to also build community, to reach out into the lung cancer community and engage with other patients and caregivers. I did have access to a counselor. I had a couple of sessions, but that sort of helped me calibrate and think about living in the moment, being much more mindful about here and now. I started doing pottery in 2019 as a way of relaxing. It was a new skill. I'd never done it before. And it was actually brilliant because it meant that for 3 hours each week, I would switch off and only focus on being creative. I can choose to let the anxiety take over, which means I lose the attention on the present, or I could focus on what I'm doing here and now and make the most of it.
TAGRISSO osimertinib is an FDA-approved oral targeted therapy used as a first treatment for metastatic non-small cell lung cancer with certain abnormal EGFR genes. TAGRISSO may cause serious side effects. Some may be severe. These could lead to death. Tell your healthcare provider right away if you have lung problems such as trouble breathing, shortness of breath, cough, or fever, heart problems such as pounding or racing, swelling of your ankles and feet, dizziness, feeling lightheaded or feeling faint, eye problems such as watery, red, sensitive, or painful eyes, skin problems such as skin reactions that look like rings or severe blistering or peeling of the skin. If you develop signs of inflammation of your blood vessels in your skin, including purple spots or redness of your skin on your lower arms, lower legs, or buttocks, or large hives on the main part of your body that do not go away within 24 hours and look bruised, or if you develop signs of blood and bone marrow problems, including new fever or fever that does not go away that is greater than or equal to 100.4 degrees Fahrenheit, easy bruising or bleeding that will not stop, unusually pale skin, infection, tiredness, or weakness. Tell your healthcare provider about all your medical conditions and any medicines you take, and if you are pregnant or plan to become pregnant or are breastfeeding. The most common side effects of TAGRISSO when given alone are low white blood cell counts, low platelet counts, low red blood cell counts, anemia, diarrhea, rash, muscle, bone, or joint pain, changes in your nails, dry skin, mouth sores, and tiredness. These are not all the possible side effects. Please see full important safety information and complete prescribing information, including patient information for TAGRISSO on tagrisso.com. If you can't afford your medication, AstraZeneca may be able to help.